atrial fibrillation. Do you know what that is?
This is like where the atrium's like kind of bounce back.
Right, so it doesn't actually fully pump things out. So what it's doing is just like pulsating, right? It's fluttering. So like the EKG, you just see like squiggles. So if the a-fib, if the atrium is just fluttering, what do you think the cardiac output is going to be?
Not very much.
Yeah, it's going to decrease, right? Because they're not pumping things out as much. They do have a rapid heart rate, but they are not pumping at all. So there's actually no contraction. Does that make sense?
Mm-hmm.
Okay. So what are some symptoms of a-fib? Do you have any idea?
You'd probably be weak.
Yeah, weak. What was the second one you said?
Tired or...
Yeah, they're going to have shortness of breath just because they're in distress, right? They're trying to get things out. They're going to have an increased heart rate, and it's going to be irregular. They're going to have angina. Do you know what angina is?
Pain.
Chest pain, perfect, yep. They're going to have palpitations, which is what?
That's nice.
Pardon me?
Chest beating crazy.
Yeah, perfect, yep. So if they're not having very strong cardiac output, they're gonna be dizzy. And do you know why?
Just not getting much blood.
Yeah, you're not getting a lot of blood to your brain. And that's why you're also gonna be confused. Perfect. Okay. Those are just the main ones. So your heart is just going really fast, not making any sufficient contractions, and forcing blood out. Okay. So what would our blood pressure look like?
It'd be lower, right?
Yes, perfect. Because you're just having less pressure because you're not pumping things out. Heart rate?
Yep.
Yep. Respirations?
Yep.
Yep. And O2?
Lower.
And then temperature, kind of trick question. It's not really affected. I suppose it'd be slightly higher just because like you're working really hard, but it's not really affected. It'd be in like the higher range of normal. But the main ones you want to know about are just blood pressure and heart rate. Do you know what a myocardial infarction is?
Heart attack.
Heart attack, right? And what's happening in a heart attack to our heart?
So it's like when you're not getting enough oxygen to your heart.
There's like a blockage in your heart, like the blood vessels, and your heart muscle is like dying and just not getting enough nutrients. So, with an MI, which is heart attack, what do you think your cardiac output would be?
Not very much decreased.
Decrease, because your heart is basically dying, right? Okay, so number 4 basically I have to know is the effective cardiac output on MI. So decreased cardiac output. Patients, like hypertensive patients are at risk for MI, things like that.
Who are?
Hypertensive patients just have high blood pressure. Increased risk.